Hi, welcome to this unique skin and hair care initiative by IPCA. I'm Mona Sharma and it's a pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair and skin care. Our skin is our crowning glory and it makes a world of difference to our appearance. However, our skin and hair also require special care and attention. Today we have with us Dr. Priyanka Sutari as a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS MD, specializes in dermatology, cosmetology, and trichology. Currently, she's practicing as dermatologist at Skin Expert Clinic, Gujarat. Dr. Priyanka has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized hair care services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Doctor is also aware of the need for the patient education and awareness about skin and hair conditions and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer a few questions on acne care for us today. Welcome to this Insta Live.
Thank you so much for inviting me.
Dr. हमारे से जुड़ने के लिए बहुत बहुत शुक्रिया. So today we are gonna talk about acne care and acne is something which is most of us is affected and when it is on our face we just keep questioning ourselves ये क्या हो गया ये क्या हो गया ये क्या हो गया. So can you please enlighten us with your profound experience, like what is acne?
See, basically, acne is part of growing up, we can say. So we don't call it as a disease. It's a part of, it's a condition. You don't name it as a disease. It's not a disease. So, it's a part of hormonal changes, your diet, your sleep pattern, your hormonal levels and all that. So, yeah, you need to get treated by the dermatologist, but if you shouldn't be petrified if you're getting a lot of acne. And it can happen on any part of the body, right from your face to your neck to your back, buttocks, arms, anywhere. So there are different varieties and categories of acne, but you should consult your doctor for that.
Okay, so doctor, that's interesting that now we know what is acne. Another very common question for the people who are prone to acne is just say that ये हो क्यों रहा है, ये किस लिए हो रहा है, ये मतलब why they are popping on my skin. So what are those triggering factors for acne?
See, basically, acne is what is acne? जो हमारा oil glands होता है, जो regularly sebum produce करता है for everyone. So in some people, they produce the sebum more. Or yeah. Some expected reasons, whether it's from the environmental dust pollution है, आपका environmental factors बहुत ज़्यादा humid है, या आप बहुत ज़्यादा different type of diets करते हैं जो हम लोग discuss करेंगे, and your hormones. तो उसकी वजह से वो हाँ, जो सीबम होता है वो हो जाता है. उस टी एक्नेस करके ऑर्गेनिज्म होता है जो नेचुरली हमारे स्किन में होता है. वो फ्लेयर अप करता है, बिकम स्मॉल स्मॉल, या तो कॉमेडॉन्स होंगे या तो छोटे पट्स जैसे बनेंगे या बॉयल जैसे होंगे. तो डिफरेंट कैटेगरीज ऑफ एक्ने होता है. सो दैट इज हाउ द होल एक्ने थिंग्स. सम पीपल आर मोर प्रोन फॉर एक्ने एंड सम आर लेस प्रोन डिपेंडिंग अपॉन द जेनेटिक्स एंड देयर लाइफस्टाइल.
Okay, so doctor, like जैसे आपने बोला genetics, so क्या ये does it runs in family and also family history does matter in acne or not?
Yes, there is a higher tendency. मतलब अगर आपके दोनों पेरेंट्स को है तो और हायर हो जाता है, एक पेरेंट को है तो मिनिमल हो जाता है. मतलब there is a tendency of getting more acne if it is मतलब if it there in the family, but ऐसा नहीं है कि आएगा ही. But yeah, there is a more higher percentage of your kids getting acne if you had got bad acne in your teenage. Yes.
Okay, so sometimes when both the parents are having acne, so maybe you can also get in your teenage.
Yeah, you can start your regime earlier. You can start taking care of yourself earlier.
Yeah. Okay, interesting. So टीनेज में अगर पेरेंट्स को भी है तो टीनेज में ही वी शुड टेक केयर ऑफ आवरसेल्फ इंस्टेड ऑफ वेस्टिंग आवर टाइम. दैट इज इंटरेस्टिंग. सो डॉक्टर, कुछ सीजन में हमारे ना हमारी स्किन बहुत ग्लो करती है, कुछ सीजन में हमारी स्किन इज लाइक टोटली डल एंड एक्ने. सो इज इट सीजन स्पेसिफिक एंड इफ यस देन व्हाट आर द मोस्ट कॉमन सीजन वेयर वी शुड टेक केयर ऑफ आवरसेल्फ एंड वी शुड विजिट टू द डॉक्टर?
Actually, it will be seasonal and climatic, geographic, both. So ह्यूमिडिटी, बिकॉज अगेन ह्यूमिडिटी रहेगा तो कोई भी इन्फेक्शन ज्यादा होगा या इन्फ्लेमेशन ज्यादा होगा. So the humid area tend to get the pore block more. So
Hmm.
you will see more acne because monsoon is favorable for any kind of bacterial infection.
Hmm.
And summers again, because summers में थोड़ा ऑयल प्रोडक्शन ज्यादा हो जाएगा,
Hmm.
वाटर लॉस ज्यादा होगा, डिहाइड्रेशन ज्यादा होगा, तो वो स्किन में इश्यूज ज्यादा होता है. तो समर एंड मॉनसून में थोड़ा सा फ्लेयर अप ज्यादा होता है, बट उसका मतलब ये नहीं है कि विंटर में नहीं होता है. वो
Okay.
इतना, it's almost the same, but yeah, it's more flared up in summers and monsoons.
Okay, so summers and monsoon, maybe we should, try to be very vigilant, and if there is something, we should go to the doctor instead of, infection होने के chances हो. ओके सो डॉक्टर लाइक कभी कभी ऐसा भी होता है कि हमारी जो ग्रैंड मदर्स हैं एंड इवन मदर्स लाइक डोंट ईट स्पाइसी, डोंट ईट पिकल, डोंट ईट दैट, डोंट ईट दिस, एंड ऐसे खाओगे तो पिंपल आ जाएगा, ये एक्ने हो जाएगा. सो इज देयर लाइक व्हाट्स द फैक्ट बिहाइंड दिस, व्हाट टू ईट एंड नॉट टू ईट बाय द पेशेंट हु आर प्रोन टू एक्ने? इज देयर एनी डाइटरी गाइडलाइंस फॉर इट?
See, the whole concept, if you scientifically think about it, is about your gut health. Basically, what they were trying to say that if you eat the spice is basically not the issue. Basically, the oil with the spice. Generally, spicy food is mixed with more of oils. So, if your gut is healthy, so you will have lesser acne or lesser seborrheic. So, you will have a lot of sugar. If you will have over too much of milk, because people who have got a tendency of PCOD or hormonal issues. So, there are some papers which suggest that over intake of milk, प्योरली मिल्क, दैट टू द फुल मिल्क, जो टोन मिल्क नहीं, जो पूरा फैट वाला मिल्क होता है वो, और उसी के सामने अगर हम दही खाते हैं तो वो प्रोबायोटिक हो गया. So they are, the same thing in two different versions. So a good healthy protein diet with a good amount of vitamin C intake naturally, कुछ भी orange, mausambi, lemon juice without sugar, and curd, and a lot of this gives us a healthier glowing skin. So we should avoid the oily, the too much of refined food, like जैसे मैदा हो गया, sugar हो गया, oil हो गया, and some dry fruits also.
ओके सो मतलब जो चीजें हमें अट्रैक्ट करती हैं एंड कि ये खाना है, तो उन चीजों से बचना जरूरी है, अदरवाइज विल ट्राई टू मेक आवर गट हेल्थ बैड एंड देन ऑफ कोर्स एक्ने हो ही जाएगा. सो डॉक्टर कभी कभी जब हमें एक्ने हो जाता है तो मोस्ट ऑफ द पीपल लाइक इवन मी, आई ट्राई टू पॉप अप एंड मेक इट लाइक अ स्कार ऑन माय स्किन, एंड देन आई फील लाइक अंडर कॉन्फिडेंट, लाइक स्कार मेरे स्किन पे क्यों हो गया. सो इज देयर एनी ट्रीटमेंट और हाउ टू प्रिवेंट दोस एक्ने स्कार बाय द पेशेंट हु आर प्रोन टू एक्ने? इज देयर एनी ट्रीटमेंट और what should the people do who have acne scars?
सी बेसिकली जो ऑयल ग्लैंड रहता है, जो वो काफी डीप होता है. इट्स ऑलमोस्ट मोर देन 7 to 8 or 9 millimeter. सो व्हेन यू पॉप आउट, वो ऊपर से थोड़ा सा निकलता है, बर्स्ट इनसाइड. प्लस वो जो इन्फेक्शन है वो पूरा इन्फ्लेम हो जाता है, बाहर जो निकलेगा वो बहुत कम निकलेगा. सो दैट कॉजेज रिएक्शन, यू कैन से, इन द स्किन, एंड इट वो स्किन को से नीचे खींचता है, जिसको फाइब्रोसिस बोलते हैं. सो बेसिकली वो स्कार हो गया. तो पहली बात तो उसको, you should not pick it up. That is most important. एंड अभी जैसे हम लोग, जैसे क्लिनिक्स में जो हम लोग ट्रीटमेंट करते हैं उसको पॉलिशिंग बोलते हैं, माइक्रोडर्माब्रेशन. सो विद सक्शन द ब्लैक हेड्स, white heads are taken out. Now for the treatments, you can undertake anything right from simple microdermabrasion to peel, to a carbon peel with the doctor. तो वो उसको पूरा को fasten up कर देगा along with the acne reducing creams, बहुत अच्छे acne reducing moisturizers and cream, and with the antibiotics or benzoyl peroxide or whatever your doctor decides. So that will avoid scarring.
Okay, so मतलब जिन लोगों को acne scars है, instead of feeling underconfident, there is always a solution for it, and we should visit to the doctor. So, okay, that's interesting, doctor. So, doctor, एक और चीज है जो कि बहुत ज़्यादा like we females can't live without makeup, and makeup is something which I think all the females love, and most of the acne I think flares up. I don't know. You can help us to know it better that makeup say acne ho jaye. So can a patient like who are prone to acne, can they use makeup?
See, how would you define makeup? So basically, what I generally tell them, don't use the creamy makeup. One, don't use a lot of foundation. You can go for a tint. So you get very nice tinted sunscreens in the for the daytime, and you can just for the luminous sheer light on that. Don't use smooth or the cake or the thick ones. Second, before applying your primer, if you're going for a wedding, a function, for a primer, you can just apply anything like a niacinamide serum. So it helps in see, ultimately there has to be some thick product in the foundation. Put niacinamide serum and then put your primer and then put your foundation. But
Okay.
preferably go for the lighter product. And you can use a heavier makeup for the eyes and lips and go very light on the face. And if you're using the blush and all that, go for powder. Don't go
Oh,
for the creamy or gel ones. And
okay.
always remove your makeup with the proper micellar water. Don't use oil cleansers because whatever would leave behind a little bit particles of oil. So micellar water is always oily skin.
Okay, so that's interesting that instead of using those creamy cleansers, we should always use a watery micellar toner kind of a stuff to remove our makeup instead of putting a lot of more moisturizer cleanser on our face and making it more bad. That's interesting, doctor. So let's like there are a lot of myths and facts which are around acne. So let's burst those through this platform and let's create a little more awareness. So people think that acne will go on its own once the teenager age is over. So what's the fact behind this?
It will depend upon the grade of acne. So
Mm-hmm.
if it is just common on grade 1 acne and they are really not bothering and they are not leaving marks and all that, you can just leave it aside with just using a good salicylic cleanser and a moisturizer and a sunscreen. But if they are grade 3, 4, they should be treated. So it is not about only about कि वो बाद में रहेगा कि नहीं. Preventing a scar is more easier than treating a scar. See,
Okay.
acne scar एक बार हो गया because of not getting the treatment, the medication done on time, then you have to go for lasers. So
Okay.
scar will be reduced by lasers or MNRF or derma roller. So why not just undergo a simple regime and some supplements or if needed antibiotic or isotretinoin and avoid the hassle later on. And there is no specific age group. See, it could be anything between 15 to 25. So how much time will you wait? Plus the
Uh-huh.
psychological impact.
Mhm. Interesting. Another very common thing, even I sometimes feel that okay, now I got a acne, I should scrub it and because it will go away. So what's the fact behind this? Whether scrubbing can help to get the acne removed more quickly?
No, like I said, acne is a whole, the pimple, the acne is a whole, it's a small department of its own. So if you just scrub it, you're just treating the 1 or 2 millimeter. And
Mhm.
instead, you're introducing, because of the scrubbing, you're displacing the sebum and the P acne. So, वो ज़्यादा बिगाड़ देगा. So, for active
Okay.
acne, we don't do any kind of medifacials.
Mhm.
I've seen a lot of people getting hydrofacial done with acne. So, basically, the massaging is going to spread it.
Okay.
So you cannot even do a derma roller. Even a medical treatment, derma roller cannot be done if you have an active acne. You cannot push it here and there.
Mm-hmm.
So not a good choice. Peeling is the best choice
Choice.
for
Okay.
active acne, the gold
Mhm.
standard
Okay, so those
with a
extrapolator
dermatologist.
and the scrumpers, they are not actually helpful. Instead, if we are having a lot of acne and they are severe, we should visit to the doctor and get the right treatment instead of scrubbing. That's interesting, doctor. And another thing is that, doctor, like once people go to the doctor and get their problem solved, then they think that the maintenance plan is not necessary. So what's the fact behind this? Does our skin require a maintenance plan? Should we go to the doctor once in a year to get our skin checked?
Yeah, see, again, it will depend upon the age group, and that is there for any age group, not acne, even for anti-aging, even for anything. So, see, in my all talk, I just say one thing. We are blessed to stay in India, where you can get a dermatologist appointment one call away. In US,
Yeah.
you get it after 6 months. So once your skin is back to normal,
Mm-hmm.
So get yourself treated every 6 months, season to season. So maybe, winter, summer,
Mm-hmm.
Holi, Diwali. That is how I tell my patients. So you should
Yeah.
meet your doctor. There are always so many new products coming up, new treatments coming up, new options coming up. So it is always better to follow up rather than doing it by your own self. So that is better for yourself.
Okay, so we should get the maintenance plan and we should follow it. And time to time, whenever we get the chance, seasonally, we should go to the doctor. That's interesting, doctor. So, like, doctor, these days, like the teenagers, even the people who are like working in IT company or anywhere, they are all stressed out, and we work like late night, and we are like whatever available, we eat that. So, can a stress and a lifestyle
Hello.
lead to an acne?
Yeah, for that sake, any skin related disorder, whether it is acne, whether it is urticaria, itching, or anything, your diet, your sleep cycle, your exercise pattern, all
Mm-hmm.
matters. Because if
Mm-hmm.
you are sometimes you're sleeping at 10, sometimes you're sleeping at 2, so your body
Mm-hmm.
gets confused. So there are some hormones which is released by the body at specific time. So your body gets confused. See, even you must be seeing people who are Indian and working for the international companies at night. They start getting depressive problems. They start getting hair
Mm-hmm.
loss. Am I there?
Mm-hmm.
Yeah.
Yes, doctor.
So of course, yeah, of course, sleep pattern is very important. Screen time is also very important, and
Mm.
proper sleep is important. Yeah, 6 to 8 hours sleep is important for sure.
Rightly said, doctor, that screen time is also important. Like nowadays, I think from 12 age until 50, 55, 60, we are all on the screen, and I think we should take care of that. That's very interesting, doctor. So, doctor, through this platform, I think we should make people aware that if you have any acne or any skincare, because people don't know like whom to visit and who is the right person to visit, because when they get acne, they get any skin problem, they go to salon and then they ask their parlor people, "मैं ये करा लूँ, ये करा लूँ, ये करा लूँ." So they are confused कि किसके पास जाना चाहिए. So when a person have any skin problem, whom they should visit and what kind of a doctor, because there are like so many doctors, MBBS, physician, cardiologist. So whom should they visit, like?
Thank you so much for asking this question. See, we have an association called IADVL, so Indian
Mm-hmm.
Association of Dermatologists and Venereologists. So you can visit any doctor who is a qualified MD or a DVD or DDVL, and preferably that person should be a member of IADVL. So you're damn sure that you are going to the right person, because अभी हो क्या रहा है, every second person is just putting some XYZ degree and charging
Mm-hmm.
almost the same what the original doctor, authentic doctors are doing. So you have to be
Mm-hmm.
smart, that you should know that you are getting treated by a qualified dermatologist. So
Yeah.
you have to just go and read the degree initials and you'll be very sure. So you have to see a
Okay. So.
dermatologist.
Mhm. So always visit a certified dermatologist instead of wasting your money on parlor and saloon and then crying and coming to the doctor and saying कि मुझे ये हो गया है. So वो frustration से जाने से better है day
उससे
one
और
से
प्रॉब्लम बढ़ जाता है and you end
yeah,
up spending more.
yeah. So then फिर डॉक्टर के लिए भी एक प्रॉब्लम हो जाता है कि उसको पहले calm down करना and then find a
True,
solution.
true.
Yeah,
And
yeah.
sometimes you are still not able to give the exact results what their patient could have had got if they would have come earlier.
Yeah, so early intervention is also one of the most important key for any problems or lifestyle disorder. That's interesting, doctor. So, doctor, now my favorite part. Can you give us some simple healthy tips to manage like a skincare or to manage acne?
In terms of skincare regime, less is more, because I've seen a lot of people who come to me with applying, 10 types of serums per day. So we should
Mhm,
not be overdoing anything. So
mhm,
basic CTMS जो बोलते हैं हम लोग, cleansing, foaming or serum,
mhm,
moisturizing and sunscreen in the morning, afternoon, because we are living in a very earlier it was twice a day, now we say thrice a day. Again, repeat the morning regime, and
Mm-hmm.
night a good cleanser and a
Mm-hmm.
night repair. Night repair will depend upon your skin type, age group, and everything. Again, the cleanser would depend upon your skin type. So basically, आपको जो cleanser use करके skin dry, dehydrated नहीं हो रहा है, खींच नहीं रहा है, that is a good cleanser. If you are
Oh.
feeling dryness, it is not good. One more
Mm-hmm.
thing, oil is different from hydration. तो ऑयली स्किन वालों को भी मॉइस्चराइजर लगाना होता है, दैट इज वाटर बेस्ड. सो दे आर
Mm-hmm.
कॉल्ड जेल वाटर बेस्ड हाइड्रेटिंग मॉइस्चराइजर और समथिंग लाइक हाइड्रोलिक.
Mm-hmm.
सो वो एक रहता है, and of course a sunscreen and a night repair, which could have a moisturizer, some little bit of azelaic acid or something depending upon your acne.
Okay, so day and night care both are important. Day में care कर ली, night में care नहीं करी तो वो भी एक problem ही है.
Equally
So we
important.
should it, so we should do both. We should balance the skin care. So this discussion was very informative, doctor, and I'm sure our viewers have found the session very helpful. So can I take some one or two live audience questions?
Yeah, please.
Yeah, so the first question from our audience is, hi doctor, I am at my menopausal age and all of a sudden I have a acne problems. A friend of mine said that if I take hormonal therapy, then all this will go away. Can you please help me? What to do?
Okay. Menopausal acne, it is called adult acne also, and it generally happens along the jawline. Teenage acne generally cheeks पे होता है. Menopausal or any hormonal acne will go from here to here. One, generally
Mhm.
for menopausal women, for as a dermat and even the gynacs, they would not really go for hormone therapy, because
Mhm.
it is part of again, good
Mhm.
skincare. Dietary changes, lot of probiotics. I swear by probiotics, because
Mhm.
probiotics set up your GI system. Some
Mhm.
if you're putting so something like a myonocyl or something, so control your weight. Diet works here a lot. Yoga or something like that. So basically, keep it holistic. Hormone will
No.
be in the very last stage for
Mhm.
menopausal, and some good
Mhm.
treatments. You've got beautiful treatments which are very safe by your
Mhm.
dermatologist. You can
Mhm.
get rid of the problem.
Okay, okay, interesting. Another question from our viewer is, doctor, someone said me that rosemary oil से और turmeric लगाने से acne चले जाते हैं. So क्या fact है? मैं लगा सकती हूँ क्या?
Okay. Rosemary oil, tea tree oil, all these oils are very good, but they have to be used in a very particular manner. Suppose tea tree or
Mhm.
rosemary oil, it's in a very diluted manner. So what happens?
Mhm.
If you react very badly, so it is
Mhm.
always better, instead of taking essential oils,
Mhm.
use it in a ready diluted gel version. I've
Okay.
seen people applying tea tree oil and getting burns. So it is
Mhm.
always better to use a gel with face for acne and which has
Mhm.
rosemary oil.
Mhm.
Because when we diffuse the oil, sometimes we diffuse it, you have to diffuse it in a particular ratio, you have to keep it for some hours and then use it. So it is very difficult for the non-professional people.
Okay, interesting. So I'll quickly take one last question because we are running out of time. So this person is asking that, doctor, I'm 35 years old and recently I've been included insulin in my regimen. I'm diabetic since past 8 years, and since I have started taking insulin and some other medications are also added by the doctor, I'm having lot of acne. So is it because of my medication or insulin, or I have some deficiency? What should I do?
I don't, sorry, I didn't get the question, but I
He's a
don't think so.
diabetic and
Insulin,
yeah, so he's a diabetic
ha,
and certain changes are done in his medications and added the insulin. So and he's having acne. So he's thinking, is it because of those medications?
no. Actually, acne में जो एंटी डायबिटिक्स होते हैं वो हेल्प करते हैं. So,
Okay.
we sometimes use minoxidil or metformin not insulin, but these two for reducing the acne. So it is going to help you. It is basically your body is still settling. So you
Oh.
work more on your diet, healthy,
Mm.
like in vitamin C, probiotics and protein, and you
Mhm.
can consult someone for maybe some antibiotics or something because it help you to curb down that. So it could be folliculitis also, not acne also. But yeah, no, insulin will never. At the injection points, you may get little bumps if it is not done in a hygienic manner, but not
Okay.
the product will not cause acne.
Okay. Okay. Interesting, doctor. So finally, doctor, would you like to give any take-home message or any other suggestion to our viewers today?
First of all, thank you for joining and listening to me. Two to three things which I always advise. You have in very easy access to the dermats. Please find your authentic dermatologist and get yourself consulted. Don't rush. Acne is not a cold or a sore throat which will go in 5 days. So give your
Hmm.
doctor 6 months to assess yourself. Let your body settle down. Give them some time. When they say guarantee or 100% result or fast result, it is not possible. The body takes a time to heal,
Hmm.
right? And self medicate and use the proper skincare regime.
Yeah, don't be your own doctor. Please find the certified doctor and get yourself treated. Thank you so much, doctor, and thank you so much for sharing all your expertise with us today and answering all the questions of our viewers today. I'm sure the viewers have found the session very helpful, and it was delight to have you, doctor. I want to talk to you more, and it was lovely talking to you. But yes, time doesn't permit. But thank you so much for your valuable time.
Thank you so much for inviting. Thank you.
And also, thank you so much, viewers, for joining us today now and asking so many questions. I could not take a lot of questions, but yes, if our doctor have some time in future, we'll take her appointment and we'll create more awareness through this platform for hair and skincare. And until then, doctor, please take care of yourself and see you
Thank you
soon.
so much. Bye.
Bye bye. Take care.